every day in my office, I see fibroid patients and I'm constantly demystifying myths. So I was really excited to join this panel because that's what I deal with every single day at the Atlanta Fibroid Center. The uterus is not the appendix. Removing it has consequences, and sometimes physicians underappreciate the value of the uterus. It's important for women psychologically. It's important for them sexually. There's a lot of bone loss after hysterectomy, and now there's good evidence to suggest there's cardiovascular effects. Well, the procedure I was mentioning, UFE, is an outpatient one, no surgery. It's a 30 to 40 minute procedure. There's a brief recovery. The approach is either from the left wrist or the top of the right leg. Both uterine arteries are blocked to the blood supply to these fibroids. Each uterine artery is like a tree and it branches. The fibroids are the leaves of the tree. So I know what size those tiny peripheral branches are, and we can plug them up as we direct a little tiny catheter the size of a piece of spaghetti into each uterine artery one at a time and deliver agents to block those tiny blood vessels. Without a blood supply, those fibroids will die, and as they die, they soften and shrink, and as that occurs, a woman's symptoms go away. She's discharged the same day, say after a 4-hour recovery, with just a Band-Aid and her uterus. There's a brief recovery at home of about 5 days typically, and we see patients in the office at 3 months. Hopefully, all their symptoms are gone and all the fibroids are dead, because if so, I'll never see them again. It's a very highly successful procedure. 90% or so get the relief they're looking for. There's a very low complication rate, much lower and much less impressive than the surgical complications. And they get what I call the triple crown, typically. 1, they get the relief of symptoms they're looking for. That's really important. 2, they avoid the risks and long recovery of an operation, and they get to keep their uterus, which again, I think is underappreciated.